Happy Monday, everybody. This is Dr. Rosado with BioCure Health. And today we have a very, very, very exciting topic that we're going to be discussing. It's about regenerative medicine, regenerative cells, stem cells, exosomes, PRP, all these different therapies that are huge in the orthopedic world right now. And we see quite a bit of it. And again, just the future is extremely bright here on this topic. A lot of research being done. And we get asked a lot of questions all the time. So we decided, you know what? Let's just go ahead and do a quick little presentation on what regenerative cells are, what regenerative medicine is, and the different concepts that come with regenerative and functional medicine. So for you guys that don't know me, I am one of the owners and co-founder of BioCure Health, located down in Miami, Florida. We are licensed in 23 states to practice. So we're very, very busy. We see a lot of different cases. And I just wanted to just kind of just reach out, get you guys this information. If you have any questions at all, you can always reach us with those questions via email or text. The email would be info@getbiocure.com, or the texting number that you can send to our office is 754-206-0838. Okay, so let's just go ahead and proceed. So first thing is the agenda. What is it that we're going to talk about, right? So I'll make a little introduction on what regenerative medicine is. The basics. We'll talk a little bit about what stem cells are, where they come from. There's different types. Not all of them are created equal. There's PRP. There's exosomes. There's a lot more items that are falling into the regenerative space, which again, like I said, super, super exciting. And then the different clinical applications. What can they be used for, right? We don't do anything in the clinic other than using them for orthopedic procedures. However, there's lots of other, countries that are really digging deep on, being able to utilize this for other issues, right? And then at the end, I always want to kind of just open up a little time for some questions and answers, right? So first thing is, what is regenerative medicine, right? So the definition is actually in the name, right? Regenerative, right? So there's degenerative, which is what most people talk about when they call up an orthopedic clinic or a regenerative clinic. Degenerative conditions are things like arthritis, different wear and tear, tearing of tissues, things like that. Regenerative is actually the complete opposite, right? So to regenerate tissue means to help repair and regrow that lost tissue. So it's not about just, slapping a Band-Aid on it and hoping that the pain goes away. It's actually the goal here is to help repair and regenerate some of that lost tissue, right? So it encourages the body's natural ability to heal itself, right? So the aim and the goal is not just to, again, like I mentioned, not reduce pain. That's not what we gauge ourselves off. We actually aim to restore proper function, right? And making sure that the tissue is actually getting better, right? So what is the science behind MSCs? So MSCs are abbreviation for mesenchymal stem cells, right? So these stem cells, they're cells that can differentiate into various cell types, such as bones, tendons, ligaments, cartilage, fat, muscle, right? These are all the different variabilities that you can get stem cells from. Now, where you can find them, and these are the more popular places, right? You can actually go from your own stem cells, or you can actually do umbilical cord donated tissue. I'm going to explain the two now. So there's a huge misconception. But bone marrow, essentially what they do is they drill a small little hole and aspirate a little bit of bone marrow, right? Your bone marrow. That then is processed and then injected back into the area that's damaged, right? You can do that. There's stem cells in the actual medulla of the actual bone, right? The next is adipose stem cells, right? These are cells that are floating around and actually stuck within and embedded within the actual fat tissue of our body. So it's like a little mini liposuction, not anything that you're going to see a big difference, but they draw out a little bit of adipose tissue or fat. They process that out, and then they can isolate certain stem cells and inject it back into the body. The other way to do it is to actually utilize donated tissue, right? The most concentrated area where you can find the highest count of mesenchymal stem cells is in the umbilical cord, right? So there's a few laboratories throughout the country that everything is very monitored, making sure everything is done properly. But essentially, what it is when a mom comes into the doctor, and the doctor's like, "Well, are you going to donate your tissue, or are you going to actually cryopreserve it for the baby for later?" Right? If the mom says, "I'm going to donate it," right? Then these stem cell laboratories then can say, "Okay, we're going to test the mom throughout the whole gestational period or the 9 months. They're also going to test the baby throughout the 9 months. And at the end of it all, if the baby is born healthy via C-section, at least X amount of pounds, right? Then they will take that umbilical cord and they will isolate from the umbilical cord. There's a little muscle in the middle. Let's say the mom's on this side and the baby's on this side, right? The muscle's right in the middle. From this muscle over to the mom's side, there's a layer called the Wharton's jelly. That is essentially a reservoir or a bank of blank mesenchymal stem cells. Those are the ones that are isolated to do these procedures. Okay. So again, 9-month-old stem cells, right? That is actually utilized for, bigger injuries that you're trying to regrow more cartilage for like degenerative changes in the joints, be it a hip or a knee or a shoulder, back issues, right? So you can actually see if you can help repair some of that lost tissue. Another form of regenerative medicine is called PRP. There's PRP, there's PRFM, and also exosomes. So we just talked about stem cells, so let's stick with that topic. If you think about a cell is a round sphere, almost like a basketball, right? So inside of that basketball, there's an empty space with a bunch of things inside. But on the outer layer, there's a layer that is actually a bunch of different little speckles of RNA. That helps reduce inflammation. It helps with the healing cascade. And those are called exosomes. Those can also be isolated from a stem cell. So you're not now doing stem cells, you're doing a component of a stem cell called an exosome. And that can be done via injection as well. Two other forms of regenerative medicine are utilizing your blood, right? The patient's blood. So here we would draw a tube or 2 or 3 of blood, depending on what it is that we're injecting. We would put that into a centrifuge so it spins very fast, right? And then those tubes, when you look at them, before you put them in, it's a tube of red blood. When you pull them out, right, it's separated. So now you have plasma on one side, and then on the heavy side is the red blood cells, which is where the iron is. What we can do is utilize that yellow liquid, which is called platelet poor plasma. But then there's like a layer that's almost like a cloudy substance in the middle, and that's called the platelets, right? So the PRP, the platelet-rich plasma. That is very regenerative and heals helps tissues heal very rapidly. So we can utilize that on its own or in conjunction with utilizing regenerative cells, right? So again, works absolutely spectacular. So there's another space now that's getting really, really big in the regenerative game, right? I know a lot of people kind of look at it, and there's a lot of influencers online right now, calling themselves biohackers. Essentially, what that word means is simply just being able to tap into your body's natural ability to heal itself and just making it so that it actually heals faster and better, right? So that's what biohacking means. These particular items that are very popular now are called peptides, right? So what is a peptide? So a peptide is a specific chain of amino acids in a specific sequence that when that gets read by your body, right, in a specific sequence, it creates an action within your body. For instance, there's some peptides that'll stimulate your brain to produce more, let's say, LH or FSH, which then that in turns stimulates your body to produce more sex hormones, so be it testosterone or estrogen. There's some that'll actually help create more collagen. There's some that'll actually help regrow and more collagen in the skin, so it tightens the skin. There's some that actually help regrow hair, right? So depending on what that chain of amino acids is or that peptide is, that will actually create the wanted action within your body, right? So that is exactly what a peptide is. So what are the clinical applications for peptides, right? So we already discussed, obviously things like Pentosan will help with repairing and regrowing and restoring cartilage within the tips of big bones, be it the femur of your leg, for your knee or for your hip, the shoulder bone right in here. All of these things can actually help repair some of that cartilage, right? Pentosan is a phenomenal peptide. FDA approved, excellent. Next thing you can use it for is aesthetics, right? So skin rejuvenation, hair restoration, right? So GHKCU is something that's used very, very commonly on the skin. And what that can do is actually help your body deposit more collagen within your skin, right? Zinc thymolene is great for reactivating the hair follicles so that you can actually start to regrow some new hair, right? Again, excellent peptides, both FDA approved. Next is longevity. Like you can use peptides for longevity. So there's peptides like sermorelin, right? Sermorelin makes it so that your body will create more what's called GHRH, growth hormone releasing hormone, right? That goes and stimulates your body to produce more growth hormone while you sleep. Growth hormone is the anti-aging hormone. Growth hormone is just an unbelievable, unbelievable hormone to help your body function more optimally and at a younger state. So you'll sleep better with more restorative sleep. It does not mean you're going to sleep more. It just simply means you're going to sleep better. You're going to restore better while you sleep. It'll help with reducing some body fat, increasing some muscle mass just naturally, right? It's just an unbelievable peptide. Another peptide that's really important for longevity is PT141. It helps amazingly, with sexual function, right? Making it so that you don't have to necessarily take, Viagra or other items that are going to make it so that your body is you're improving your sexual capacity. In this particular case, PT140 can do that for you naturally, right? And then methylene blue is a huge one that's very popular now, along with NAD. And those, like for instance, NAD is NAD plus. That has a positive charge. And what that does is that'll actually help activate or give energy to the mitochondria of the cells in your body, right? Very important. So that what it does is it activates the function of all the cells of your body. So one thing that I use it for all the time, and I absolutely love it for it, is one of the highest accumulations of mitochondria in your body is in your brain. So if you can activate the cells of your brain to function better, you're going to be able to think better, think quicker, think faster. Another thing is great for detoxification. We have a huge bank of mitochondria within our liver and our kidneys, the cleansing organs. And what this will do is it'll help your body detoxify better. So again, NAD, amazing. And then methylene blue. Methylene blue actually donates, it helps attract oxygen to these areas. So it's great for mental health. That's something that I highly recommend for a lot of people. Just make sure that you're always, always, always doing blood work prior to all of these, taking any of these, because I know a lot of times you can find these online and, non-prescription, but like what exactly are you getting? It's very important that you're being monitored by people that know what to look for, but that you're also taking the right thing, right? Like you might not be buying real methylene blue. You might not be buying real sermorelin, right? And then, like I said, at the beginning, the future is extremely bright. There's a lot of ongoing research here with peptides, how it can help cardiovascularly, how it can help neurologically, so much more. The future is extremely, extremely bright there. So, what is the research being done and the future outlook? So there's constantly a growing number of clinical trials for stem cells. I know from where I'm from, down in Miami, a lot of the larger universities are doing tons of research studies on stem cells, exosomes, different peptides. And I think, as a clinic, it's very important, right, to make it so that there's a lot of safety and regulatory standards to be held very high when it comes to this world, right? Because it's not just that anybody can do it. I don't think anybody should be able to do it. I think the right people should be able to do it, right? So very important that you're not just working with a clinic that does it. Make sure you're working with a clinic that's actually specialized in that. Look for items like fellowships, board certifications, right? In regenerative and anti-aging medicine, metabolic medicine, things like that. Another aspect which is greatly overlooked, excuse me. Another aspect that's greatly overlooked is lifestyle, right? I think a lot of people, unfortunately, they're like, well, if I take this, I can still eat like garbage. Or if I take this, I don't have to work out because I'm still losing weight, right? So it's very important just to live a healthy lifestyle with proper nutrition, enough and adequate exercise, reduction of stress, right? And then making sure you're getting sufficient, restful, and replenishing sleep. Super important. I can't stress that enough. What are the potential risks and different things to consider, right? I already talked about it earlier. Doing blood work is essential, right? So what you want to do is you want to make sure that that your body can process these things out, right? There's a test specifically to make sure you can process out methylene blue. There's a test specifically that to make sure that your body's liver and kidneys can process out different peptides, different hormones, different items that is extremely important to make sure you're working with the right team, right? You want to make sure you're choosing the reputable providers. And just understand this is in no way a quick fix. It's something that you're going to utilize, you're going to implement it into your lifestyle so you can get the best results possible, but making sure that you're not just leaning on this, making sure that you're using it as a tool, not as a crutch, is essential. So I gave a lot of information there. If you guys, and I know there might be a lot of you that we usually will ask questions or send emails or text messages or send us messages through, Instagram or stuff like that. So if there's anything that you guys want to dig deeper into that you don't want to necessarily share with the public, I'm here to offer you guys a complimentary one-on-one phone consultation with one of our specialists at the office, just for being a part of this webinar, right? I think it's extremely important for the knowledge to get out there so you guys understand exactly what it is that we do, how we do it, why we do it. All right. Another exclusive webinar perk is on your first order, if you mention this webinar with the date that you're watching it, I'm going to offer you guys a 15% off of your first order, right? As I mentioned, and here's the thing, you need to have labs. So you need to have blood work. We need to do the interpretation. And then off of your first order, I'm going to give you a 15% off. And then I would love it if you found this information, good and you learned a lot and you want to learn more. Please follow us on Instagram. Our handle's at GetBioCure. Also sign up for our newsletter. We put in a lot of work to these newsletters. We put a lot of effort. We try to make it so that it gives you a lot of good information, actionable information where you can read it and immediately do something about it, right? It has nothing to do with the clinic. It's just about making sure that our communities that we're working with are just healthier, right? So you can sign up at www.getbiocure.com. There's a little pop-up that pops up. Just put your email address there and you'll be signed up for our newsletters. All right, so for more information, you can contact us online, getbiocure.com. You can email us at info@getbiocure.com, or you can look us up on social media, Instagram, Facebook at getbiocure, or you can just call or text our office number, 754-206-0838. Thank you guys very much for sticking around till the end. I hope you learned something, and I wish you the best of luck with your health. If you think that we can be of any assistance to you at all, please do not hesitate to reach out. I look forward to speaking with you.